Okay, thank you everybody for joining us today. My name is Don Walker and I'm the Communications Director for Brevard County Emergency Management. Brevard County Emergency Management's foremost priority is the safety of Brevard County residents. And in that regard, we are closely monitoring the alarming uptick in COVID-19 cases in our county. We are working very closely with our local healthcare agencies and the Florida Department of Health Brevard, and we are holding this video press conference today in an effort to keep our community informed. Currently, the county is focusing on sharing the importance of getting vaccinated and for following CDC recommendations to protect yourself from contracting this potentially fatal virus. Vaccine is readily available in our county, and it is recommended that anyone ages 12 and older get vaccinated, whether it's through your personal physician, an urgent care, a local pharmacy, or Department of Health Brevard clinics in Viera, Melbourne, and Titusville. Now I'm going to ask Barry Inman, who's the epidemiologist with DOH Brevard, to provide us with an update and hopefully shed some light on what's happening in Brevard County that's caused this spike in COVID cases. Dr. Inman, if you would please.
Okay, thanks, Don. I appreciate the opportunity. Well, currently we have over 46,000 cases, from when this pandemic began. We're approaching 1,000 deaths of this virus, and we are seeing quite an uptick in our cases, of course. And to give you an example, a couple of weeks ago, we had 700 and just over 700 cases for the week. Last week, we had over 1,500. And so far this week, we have 2,500. So there's no doubt that we're going to double our cases from last week, unfortunately, with this virus. So far as the transmission goes and what's fueling it, probably a few indicators. One, which you already mentioned, is that we do need more people vaccinated. We have just over 50% of the population that is fully vaccinated. And of course, with this Delta variant, which without a doubt, we have it here, every specimen that we have sent up, such as like we've had in outbreaks or severe cases in the community or deaths, they have come back positive for the Delta variant. And of course, this Delta variant is 100 times more infectious than any other variant that we've had in the past. And to put it in perspective, with the initial wild virus that we had, when the virus first came into our community, the reproductive ratio, or RO ratio, was about 2 or 3. That is, you would infect 2 or 3 people. With this Delta variant, it has moved to 5 to 8. That's getting fairly close to the reproductive ratio of measles, which can be anywhere from 10 to about 18 or so people that can be infected. And measles is extremely infectious. It's the most infectious organism we have on this planet. And of course, with people not wearing masks as readily as we once were, that is transmitting it. People getting in large groups of gatherings and what have you, transmitting it. We are having outbreaks, particularly in our camps with our children. And there are all sorts of camps that we've seen with that. Our daycare centers, we have seen outbreaks, of course, with that. Our long-term care facilities, although most of them have done fairly well, we have had some that have had outbreaks, of course, and attack rates of 20 to 30%. We do see people who are vaccinated but become infected, but generally we find that they're not hospitalized and they certainly don't expire from this virus. So there's probably been a little bit of our letting our guard down in the community. Unfortunately, Certainly, but our biggest concern, of course, is that we just don't have enough people vaccinated to thwart this ongoing pandemic.
My apologies. Okay. I'm sorry, what I was trying to say after Dr. Inman spoke was that we will open the floor for questions from the media once we do briefings from all of the panelists on board today with us. One of the things that we're noticing from a county standpoint that has been acknowledged by our fire chief is that the number of daily transports of patients with COVID-related symptoms to area hospitals is back at the peak levels it was during the peak of the pandemic earlier on. So we're looking at roughly a dozen of those transports a day. And what they're finding when they get to hospitals are crowded emergency rooms. So we have invited all representatives from all of the area hospitals to be on the panel today. And we're going to start off with just an update of what's happening at Parish Hospital from Edwin Lofton, who is their Senior Vice President and Chief Nursing Officer. Edwin, what can you tell us of what you're seeing at Parish Hospital, and what do you think it's going to be looking like moving forward as far as the impact it's going to have on your staffing and also your hospital as a whole?
Thank you for the opportunity. And let me start off with saying that, again, all three systems have been coordinating and working. All three hospitals have a daily call at this point in time in which we cooperate to make sure that we've got the resources and the flexibility to meet the needs of the entire county. Parish Medical Center in the north part of the county, like every other hospital, has seen a significant surgence in COVID cases. For example, on June 19th, we had 2 patients in house with COVID-19, and we're actually looking at planning a zero patient party. Well, fast forward to June 29th, and today we have 46 patients with COVID in-house, 6 of those in the ICU and the rest in the med-surg area. This is almost twice as many as we had at the peak in July of 2020. Of those patients, 96 of them are completely unvaccinated. So back to Barry's comments and your comments early on, the impact of vaccination is significant. Parish Medical Center is providing the resources needed to take care of these patients. We have flex staffing. We have taken a couple of significant actions, including stopping elective surgeries so that we can use those resources, those nurses and assistive staff at the bedside. We're meeting the needs of the patients. We, like you said, Don, have had a large volume of patients in the ED. We are managing those patients, moving through. We're making sure we get a triage done early and often, and are looking at making sure that whatever the community presents and needs, we will do. We're also in the middle of moving our vaccination clinic, which has been at our facility on Highway 50 for the past several months, to our south end parking lot effective today. We're actually erecting a tent today so that we can do both acute care, vaccinations, and testings all at our North Washington location.
All right, Edwin, thank you very much. And I know they're seeing similar things at Health First, and we've got Dr. Jeffrey Stallnaker on the line with us today. Dr. Stallnaker, what's the situation there at Health First, and what impact is that having on your staff, and what types of steps is Health First taking in regard to all of that?
Thanks, Don. And we had to just move a little bit. We got a fire alarm going off, so we're not ready to evacuate yet. We found a little quieter place. Well, first of all, it's just great to see my colleagues on the call, and just know that we certainly appreciate all the great work you're doing as well. So our experience at Health First is similar. After the New Year's holidays, our highest average daily census hit 111. This morning we're at 172. So we've seen the same dramatic increase over the last few weeks. So we're sort of in that disaster planning mode as well, identifying space and so on. Looking at some of the models, it would appear that we're going to be in this at least well into August. So we're putting contingencies in place to be able to manage that. And again, we're finding the same thing. These are basically unvaccinated individuals.
Okay, thank you very much, Dr. Spellnaker. And on that note too, we'll move over to Stewart Hospital for an update from Dr. Nick Moratti about what the conditions are there. Doctor?
Hey, well, good morning, everybody. Appreciate you having me, and again, appreciate a lot of familiar faces coming together so that we can kind of share and communicate. We're kind of seeing the same thing at our 3 Stewart facilities in the area. There's been an increase in volume really all across the board. In addition to COVID, there's been an increase in non-COVID volume, which puts a little bit more strain on all of the resources of the community. We also have seen about 98 to 99% non-vaccinated rate among our patients admitted with COVID-related illness and disease. It's been kind of great to work among the 3 different Stewart facilities, because the way that we've addressed it, as always, is we kind of pull resources, send the resources to where they're most needed in real time. You know, the censuses at each site change throughout the day. And it's been great to work with partners in the community, such as Health First. At my site at Melbourne Regional Medical Center, in addition to working with the other Stewart sites, we also work very closely with Holmes Regional Medical Center, because we serve kind of a close demographic together. And it's just great to see the community come together to try to address this. Our rates are way up. We have been able to address it well thus far. We also project it to be continuing like this for some while. So we're battening down the hatches and ready to continue to address this storm.
Thank you very much. So I wanted to, initially we were going to do this as a Facebook Live, but because of the rising numbers of COVID, we decided that it might be best, because we wanted the hospital's involvement, to do it as a Zoom call where we could all be here and be in our own respective areas. But I did invite all the media out today, because I know they've got a lot of questions. They pose a lot of questions at me, and I'm one of those stay in your lane folks. So when they ask me hospital questions, I don't even begin to try to answer those. So I'm going to open up the floor for questions from the media. Members of the media, if you would identify who you are and what your respective news agency is when you ask your question, I would greatly appreciate it. And we'll get that started now. So if you have a question, if you want to direct it at anyone in particular, that might be best, just so we don't have at once. But please go ahead. First one.
All right, I'll go first then. Don, this one's for you. Is the county doing anything to incentivize or try to get people to get vaccinated who aren't otherwise? Because it does seem like this is primarily hitting the unvaccinated population right now.
Hey, sure. And since you didn't do it, I'll identify. This is Tyler Vasquez from Florida Today. So Tyler, what the county's doing, starting early last week, I began putting out daily press releases encouraging people to get vaccinated and to do so as quickly as possible, to follow the CDC recommendations. I know emergency very closely, as I said before, with all of our healthcare agencies, and we're monitoring this very closely. And, you know, from what we do from that point, will either be directed by actions that are taken by the state, or that are directed either from the county manager or from our Board of County Commissioners. So that's our main goal right now, is to help these health organizations as best we can to keep people from going to their hospitals with COVID symptoms, because we're getting them out there and getting them vaccinated. Next question, please.
This is Dave Berman at Florida Today. I want to ask if any of the hospital officials or the health department feels that other measures should be put in place by county government or city government to kind of stop the spread of the virus, as far as masking policies, which some other counties and cities have been looking at, or any other guidelines related to social distancing other than what's voluntarily in place now.
So if anyone wants to speak up from the hospitals, otherwise I'll pick somebody just to keep everybody from talking over each other. How
I
about
wouldn't
Dr.
mind addressing a part of that, if that's okay.
Yes, sir.
Sure. So I think that the policies that are in place are good ones. I think that a lot of us have noticed, let's say we go shopping Publix or somewhere, it's clearly stated with signs on the doors that say, if fully vaccinated, masks are voluntary. If not fully vaccinated, masks are mandatory. And yet when we look around, maybe 1-2% of people are wearing masks, but only 50% are vaccinated. Well, to me, those numbers don't add up. So some people aren't playing by the rules, and that might be partially contributing to the breakout we have. Kind of touching on Dave's point and back to what Don said earlier, how would the group here feel about maybe taking some questions from the community that we could all address? Because I've noticed there's a lot of misinformation out there everywhere in the community in terms of what the vaccination is, what it means, what are the actual side effects, what are the dangers, things like that. I'm just wondering if people could submit questions where we could answer it in kind of like a town hall style thing or something with pre-recorded questions. Maybe education of the community would be the key to improving the vaccination rate.
Sure. And Dr. Marotti, I mean, it really plays right into what we're going to do with this. My goal after this event is concluded is we will get this posted on social media, and we will be entertaining questions from the public because we do want them to be able to ask their questions. And that's another reason that I'm going to announce later that we're going to be re-implementing our weekly Facebook Live events where we would provide updates to the community on where we stood as far as events occurring during the pandemic peak. But yes, we will be posting this on social media today. We are going to entertain questions from the public. And once those questions are received, we will be reaching out to you and others in the medical community to get those questions answered. And that way we are going to do our best to get that information out there because we know there are a lot of questions. The reason I invited all the local media here is because I felt under this platform of doing a video press conference that they would help us best spread the message quicker and faster than if we just did this and posted it ourselves and didn't entertain any questions from anybody. So that's why we're doing this today, but that is an excellent suggestion and one that we've anticipated that we would need to pursue moving forward. So thank you very much. All right, any other questions from the media, please speak up.
This is Mel Holt with WFTV, and it sounds like from what you all have said that you are seeing higher numbers, if not the same numbers we saw at our previous peak in terms of your COVID cases. I'd really like to know how you're doing, and this is to each of the hospital systems, how you're doing in terms of your bed capacity right now. I know that obviously there's been some delay of elective surgeries. I saw the tent outside of homes yesterday, but how are you doing in terms of your capacity? How much room is left here?
So Mel, I'll take the first one. It's from Health First. For us, it's probably more of a staffing issue than a bed issue. I mean, across our IDM, we do have the ability to flex quite a bit, tight on traditional ICU beds, but again, that's more of a staffing issue, and we're able to flex other beds to meet the needs of critical care patients. But along with those beds, you have to have the folks to take care of the patients. And this has gone on for over a year, and people are tired, and there's a lot of folks that are moving around really across the country, taking per diem positions and so on. So I think pretty much across Central Florida, and I think our other healthcare colleagues here are facing the same issue with staffing.
All right, very good. Any other questions from the media, please speak up.
Hey, Don, Greg Palone, News 13.
Greg.
And this can be for anyone on here. We've talked about the cases going up, the positive cases. What are the numbers right now as far as the death rate here in our community?
That sounds like a question for Barry Inman.
The death rate is right at about 2%. Now, compare that to the flu, which is 0.01%. This is very, very significant. Then again, our deaths are far mostly occurring among those people that are not vaccinated.
Yeah,
Thank you,
Greg.
Doctor.
And Greg,
Good, Don. I just had a quick follow-up for him if I could.
go ahead.
Do you have, Doctor, do you have numbers on that as far as how many deaths have taken place? And I don't know what date you would start from, maybe essentially when cases started going up. Do you have the number of deaths that have happened in that period of time?
You mean during the surge?
Yeah, whenever that milestone began or whenever that marker began, and then until today.
Well, as I said, we're approaching 1,000 deaths early on with that. We're not seeing an increase in the death rate. We're actually seeing somewhat of a decrease, particularly from a couple months ago with that. And that's due, of course, the hospitals are doing their treatment therapies, of course, that they do, and what have you with that. So that's helping a good bit. And of course, if the patients get to the facility early enough, there's other therapies that, of course, that they can utilize. But we were decreasing quite a bit in June. We're seeing an uptick, but believe, and of course the other physicians, of course, can speak into this, but probably we're seeing somewhat not an increase in deaths necessarily with that because of the people vaccinated. We didn't have at least 50% of people vaccinated. We might be seeing an increase in the deaths that may be occurring there.
Thank you.
Did anybody else want to add to that? Otherwise, we'll move on to the next question.
Don, I would just make the comment too. Remember, deaths are a lagging indicator. Younger group that are being infected, so they are generally doing better. But I think we're yet to see, as the surge goes on and we start moving toward the peak, I think we're yet to see what the mortality is going to be.
And Don, to further what Dr. Stalmacher said, in reference, yes, we are definitely seeing a younger population. In July of 2020, our average age was around 65. Right now, the median age for the patients at Parrish Medical Center is 55. So we've seen a dramatic decrease in age.
Okay, very good.
Don, if it's okay, I'd like to add one point as well, just that we're kind of seeing the same thing, but I will point out that when we compare this surge to the initial surge a year ago, we actually have better treatments and therapies now and more evidence behind those therapies. So in a lot of different ways, we're in a better place than we were a year ago to handle the surge.
Agreed.
Okay, excellent point. All right, any other questions from the media? Please speak up.
Yes, Don,
Go ahead.
this is John Shabbat with Spectrum News 13.
Yes, sir.
I had a question for the hospitals. Considering the fast uptick in the cases that we're seeing, I'm hoping that maybe the hospitals can speak about the PPEs. How are they doing, supply wise? And is there a concern for the future?
Don, I'll be glad to take that as a start. At Parrish, one of the things that we did early on in 2020 is we set a goal of having 365 days worth of PPE on hand. And we were able to achieve that back in the fall of last year. So now as we go through the surge, we are well prepared. We have ample PPE for all of our care partners, all of our providers, and for family members and patients. So we believe that we're prepared. We thought ahead, and maybe it's luck, but lucky's better than good some days.
All right, very good. Dr. Marotti, what's the situation at Stewart?
Kind of a similar situation. We have 44 hospitals across our network. We also stored up to prepare just in case there was another surge such as this. And fortunately, we live in this wonderful capitalistic country. So when the production of masks started to ramp up during the last surge about a year ago, there seemed to be a great amount of availability for the PPE for really all health systems to store up. And Stewart definitely took that opportunity to store up to be prepared.
All right, and Dr. Stalnaker, any input from you on that?
We did the same thing when things let off a little bit and the supply chain opened up. We took that opportunity to increase our number of days on hand. The only thing about days on hand is it's a number based on where you were at the time. When the numbers go up, the number of days on hand go down, but we feel pretty good around PPE.
And Dr. Inman too, I know FDOH is very much involved in this, obviously. Where do you guys stand on PPE supplies?
Well, generally, the community is in pretty good shape. Our long-term care facilities and other facilities we deal with, and us here, of course, here at the health department, we seem to have ample supply. So there doesn't seem to be, it's rare that we see anyone lacking in PPEs.
Okay, thank you very much. Okay, anybody else with a question from the media?
I do have another question. This is Mel Holt again, Don. This question may be to Barry Inman or anyone else who cares to answer. Brevard County, like a lot of school districts right now, is mask optional, and a matter of days, school will be resuming, and of course, it's during a surge. I know there will be a discussion tonight among the school board, but how concerned should parents be at this time? Because at this point, children 12 and under cannot be vaccinated as they return to school.
Well, I'll leave, but I certainly hope the other hospitals will tune into this also. But you know, whenever you have people gathering, and when you have as transmissible a virus as this is, there's a lot of fertile ground for this virus to transmit. Now, CDC did do a study back, some months ago, and showed that there was really not much difference between the children acquiring this in the community versus the school. The thing that concerns me some is that, of course, that was not dealing with the Delta variant. Now we're dealing with the Delta variant with that. So one thing, the health department is going to be monitoring this extremely closely. We have quite a number of employees that will be working with the school board, and of course we'll be identifying children, and of course if they're infected, then of course they have to stay out generally 10 days in most cases with that. We will be quarantining, so if anybody comes in contact with a child or even a faculty member or what have you or whatever with that, then of course they'll be quarantined with that. We try to be monitoring the children more closely. Alcohol hand rinse, of course, that will be wide available. The school boards are getting some funding to do some ventilation assessments, and maybe some of the older school augment some of those, so you may have less aerosol transmission of the virus.
Okay, thank you. Any other questions from the media?
This is Dave Berman, Florida Today. I had a question about the restart of cruising at Port Canaveral, kind of two areas of that. Is anybody would like to address whether there's concern about all these tourists coming in from out of town for these cruises, and also a concern about how safe are the ships for people going on the cruises, where there's thousands of people in a confined area now?
Don, I'll speak up to this one. Dave, Paris Medical Center has had the privilege and the honor of partnering with Port Canaveral and multitude of cruise lines. We have been providing the vaccinations to the cruise line crews for well over 3 months now. I think we provided over 8,000 vaccines in the arms of the cruise over time. The cruise lines are taking this very seriously. They are, as you've seen, as you all have reported on, they've done their test cruises. They're creating the safest environment they can. And again, and I know Stuart and Health First are on board. We're here to support our community and the economic return in a safe, appropriate manner.
All right, thank you. Anybody else want to address that, or we'll move on to the next question?
I might lend a small point to that. It's totally agree with what Edwin had said. A part of the question seemed to be, what do we think about that increased visitor population coming from out of state into state just for the cruise lines? But I will say what we've seen, as I alluded to earlier, was an increase in volume overall. And I think a part of that is due to increasing population size of Florida overall. What we've noticed is a lot of winter birds that usually come for the winter and then start to head back to other states in the spring have decided to stay in Florida. And we're also having a lot of other people moving to Florida that I think is higher than normal for this time of year. So I think we're already seeing that bump in volume. I don't know that the cruise ship industry is a big enough percentage to make it a noticeable difference for us at the hospital level.
All right, thank you. I think we'll entertain maybe one or two more questions and we'll wrap it up at that point. Anybody in the media have any additional questions?
Yeah, I have one. This is Tyler with Florida Today again. And this is for Barry and Min, but for also any of the physicians who might want to chime in. A lot of the framing of the current surge around the country is that it is, in just what the doctors have said, it is a surge of unvaccinated people. But as we've seen with the Delta variants and even some other variants, how soon could this become an issue even for vaccinated people if more variants are able to breed in the community and more easily break through that vaccine?
That's going to be a concern because if we don't have more people vaccinated, then the virus can continue to replicate, and it's going to get more efficient at attaching to our cells, our respiratory cells, and other cells for that matter in our body. So that's a concern. And also, we have to be cognizant that this is a small world. And I think in the world, we have just over 1 billion people that may be vaccinated. There's 7 billion on this planet. So we've got a large task in front of us. However, we have seen some communities up north, particularly that they have a high vaccination rate of their communities, and there's little or no, virus coming in. So the best thing we can do to try to reduce the onset of other variants is to, of course, get vaccinated. And of course, that's what we've done with other diseases also that we deal with.
All right. Did anybody else want to address that before I go to the next question?
Can I perhaps rephrase a little? Oh, sorry, go ahead.
No, go ahead.
I was just going to slightly rephrase what Barry was saying for the viewers out there. That a virus or bacterial infection can work is if you partially treat it, that increases the chance of your resistance. So if you think of it as us fighting the virus or us fighting some kind of bacterial infection, if you partially treat, same way if you partially immunize, I think it leads to more variants that are more deadly, that can harm us more. And I think that's where Barry was going with the more we get vaccinated, the less likely it is for these nasty variants to pop up. Is that what you were going for, Barry?
Yes, sir. Thank you for your help.
I would agree with both of my colleagues, put it well. It has to grow to mutate. And so when you have unvaccinated individuals, you give the opportunity for the virus to expand, and that's when it mutates.
All right, thank you, Dr. Stallmaker. All right, we'll take one more question before we wrap it up. So who's got one? All right, nobody with a question?
What's for lunch?
There you go. Well, first and foremost, Dr. Stallmaker, Edwin Lofton, Dr. Marati, and Barry Inman, thank you all very, very much for being on our panel today. I think we're able to get a lot of information out there that people need to hear. I know we answered some questions that the media has needed answers to, so I thank you for that. I do want to reiterate that we are going to re-implement our Facebook Live COVID-19 updates starting next Thursday. We'll be holding those on a weekly basis. I'm sorry, we may be actually holding those on Friday. So it's kind of still in flux, but look for it either at 11:30 next Thursday or 11:30 next Friday. I will send out a press release to let you know that we're holding that. We plan on broadening our panel in the future to include other experts like we had on the panel today. And then finally, I'm going to end this video conference by imploring anyone who's watching this that hasn't been vaccinated to do yourself and your loved ones a favor by getting vaccinated as soon as possible, not only for your own personal safety, but also for the safety of your loved ones and others in our community. So thank you for joining us today, and we'll talk to you next week. Thank you.
Thank you.
Thank you, everyone.
Thank you.